Let's talk about mental health and substance abuse treatment for ICD-10 PCS coding. This week you'll learn about the root operations used in the mental health and substance abuse sections. You'll learn the character meanings for the mental health and substance abuse sections, and you'll be able to code from the mental health and substance abuse section of ICD-10 PCS. Mental disorders are disorders that affect the ability of a person to function in a healthy, socially acceptable way. Psychiatry is the branch of medicine that treats individuals with mental disorders, which include emotional and behavioral disorders. The Diagnostic and Statistical Manual of Mental Disorders is the main reference guide for mental health professionals when assigning a diagnosis code to a patient's encounter. A mental disorder can manifest itself at different levels of severity in different patients. The Diagnostic and Statistical Manual of Mental Disorders helps define conditions for healthcare professionals to appropriately identify a disorder. Both the mental health section and the substance abuse treatment section of ICD-10 PCS are discussed in this PowerPoint presentation. Let's talk about the mental health section first. The mental health section of ICD-10 PCS is identified with the first character value of G. All services coded from this section begin with the letter G. In other sections of ICD-10 PCS, the second character position represents body system, anatomical region, physiological system, or section qualifier. In the mental health section, the second character position always has a value of Z, none. So, for example, the first character would be G for mental health. The second character would be Z for none. And if the patient was having psychological testing, the third character would be a 1. The third character position in the mental health section specifies the root type. In the case of mental health, the root type is the specific service provided, such as psychological testing, counseling, family psychotherapy, individual psychotherapy, crisis intervention, and several others. Each of these root types has a character value, and the definition is provided next to the root type listed in both the introduction and at the start of the table. The fourth character in the mental health section of ICD-10 PCS is the type qualifier. The type qualifier is the fourth character of a code and is used to indicate more information about the root type, which is the third character of the code. Characters 5, 6, and 7 are qualifiers in the mental health section and have a value of Z, which is none. The Z must be used as a placeholder because all codes are reported with 7 characters. In general, abuse is described as the use of a substance, example alcohol, drugs, tobacco, in excess without having a physical dependence. The abuse may or may not be to the point where it is having an impact on the patient's daily life. Addiction is described as abuse to the point where a person cannot get by without the substance of choice, example again, alcohol, drugs, or tobacco. The body has become physically dependent on the substance. Patients seek care for both abuse and addiction. The section identifier for substance abuse treatment is H. This means that the H is located in the first character position. The second character value is for the body system. Because this value does not apply in this section, the value of none is indicated by the letter Z. Like the third character position in the mental health section, the root type in the substance abuse treatment section identifies the service performed. These services include detoxification services, individual counseling, group counseling, individual psychotherapy, family counseling, medication management, and pharmacotherapy. Detoxification services are from alcohol and/or drugs. In individual counseling, the application of psychological methods to treat an individual with addictive behavior. Group counseling is the application of psychological methods to treat 2 or more individuals with an addictive behavior. Individual psychotherapy is the treatment of an individual with addictive behavior by behavioral, cognitive, psychoanalytic, psychodynamic, or psychophysiological means. Family counseling is the application of psychological methods that include 1 or more family members to treat an individual with addictive behavior. Medication management is monitoring or adjusting the use of replacement medications for the treatment of addiction. Pharmacotherapy is the use of replacement medications for the treatment of addiction. Pharmacotherapy is the use of replacement medications for the treatment of addiction. The type qualifier is the fourth character, and this further explains the root type, the third character. The values vary according to the third character assignment. Therefore, the tables have to be referenced for specific values in definitions. Characters 5, 6, and 7 are qualifiers in the substance abuse treatment section and have a value of Z, none. The Z must be used as the placeholder because all codes are reported with 7 characters. So let's go over some key points. Abuse is described as the use of substance in excess without physical dependency, whereas addiction is described as when a person is dependent on substances such as alcohol and/or drugs. Okay, let's do a coding exercise. Select the code for the following: medication management of abuse. The correct code is HZ83ZZZ. H for substance abuse treatment, Z for none, 8 medication management, 3 anti-abuse, and then of course Z, Z, and Z as placeholders because every code has to have 7 characters.